Hello, and welcome to Read Scholars Live. I'm your host, Dr. Mary Fleming, and current president of Read Scholars. I am joined today by Dr. Makini Chisolm-Straker, who is an assistant professor of emergency medicine at Mount Sinai, Brooklyn. She received her bachelor's degree and MD from Brown before returning to New York for residency at Mount Sinai Medical Center. She also completed an International Emergency Medicine Fellowship at Columbia, where she received her MPH. Dr. Chisolm-Straker is committed to the health of invisible populations, and her work focuses on human trafficking and transgender health in emergency settings. In addition, she's the co-founder of Trafficking Incorporated. Welcome. Thank you so much for joining us today.
Thanks for having me. I'm glad to be here.
So how are you? You're in New York. How are things there as they've evolved over the summer?
I'm pretty all right in the grand scheme of things. I will say updates to that bio. I was recently promoted to associate professor. So hooray, that's been a summer development. And I am now at Mount Sinai Queens. But it's the same system, it's the same health system. Yeah, I think the big thing now is I'm trying to figure out where, if anywhere, can I go on a vacation that I am taking, because there may not be time for it, but I need it. And there's not a lot of places I can go. I saw an Alaskan resort I'd like to go to, but the resort requires Alaskan ID. Wow. So yeah, I don't know what I'm going to do. So these are my quote unquote big problems right now. So that's not so bad, right?
Yeah. I mean, I feel you. I'm used to traveling a lot, and with COVID, it's kind of I need to be cautious because we need to respect this thing that coronavirus is.
Yeah.
It's also tomorrow's not promised, right? Because we know how things
exactly
quickly change, and trying to figure out how to balance both of those. It's a little tricky in working in self-care. So I definitely understand that dilemma.
Yeah, it's been a little tough, but what are you gonna do?
Here we are. This is
you roll with it. Yeah.
So I thought we'd start with just a little bit about your journey, and if you could share with us why you chose emergency medicine, and then what led you to go on after that to the International Fellowship.
Sure. Well, unlike I think many folks who go into medical school, I knew that I was going to be an emergency medicine physician. So I wasn't ever like, oh, I wonder if I'll be, or I'm choosing between these couple things. I specifically went to medical school for this. I had early exposure in life to the specialty, and for me, it was a job, frankly, that allowed me to, in some way, engage in social justice work using healthcare as a vehicle for social justice, given that the ethos of emergency medicine by law and ultimately by practice is that we see any and all comers regardless of anything else. So that was the initial like, yes, this is home, in addition to the fact that I sort of grew up in an ED. Then as I sort of was going through medical school, I started an undergrad actually volunteering internationally, and that sort of naturally transitioned in medical school. And then, by the time you're a resident, you actually have some skills, right? You actually have some capacity to be of use. And so that was sort of the spiral of, oh, I can actually be useful in other places, even though I haven't completed residency, but I did want to do that responsibly and ethically. Just because you're not in the US doesn't mean that it's ethical, moral, right, whatever the word of the day is, to go to another country and quote unquote practice on folks. And so it was important for me to, even in residency, make sure that I'm under the guidance of what would be considered an attending in the US, and that I wasn't ever acting outside of my clinical scope or capacity. And so as I did more and more of those experiences, frankly, mostly just doing clinical emergency medicine in other countries, I came to see sort of experientially what I think other folks were probably telling me, but I wasn't fully understanding, which is that is sort of Band-Aid work. I, at the end of the day, feel good about myself, but it's not it's not sustainable. It's not sustaining the people there. It can't be sustained by them necessarily, depending on how it's implemented. And I want it to be a part of processes and movements and actions that were by the people and for the people, and
Mm,
that they didn't need me. I could come be a part of it, but I was sort of extra,
right.
or that I was offering, an expertise that was only actually needed for a short term, from a research endeavor or something like that. And so that's how I ended up doing that fellowship.
I like it. And so I guess the next question, trying to figure out which one I want to ask first. So of course I want to talk about human trafficking and how that evolved for you. But I also want to talk about what human trafficking is. And so I think what was poignant for me is when in the modern day, this was several years ago, but when we recontextualized, the
Mm,
slave trade and how slavery um, using that as a context or comparison, I guess, if you will, to the modern human
hmm.
trafficking. And I know for a lot of people, when they think about human trafficking, we often think about the sex exploitation arm of it, but it's much bigger and
Yeah.
broader than that. So I guess however you want to weave those two questions together, I'll just throw it out there and let you
Okay.
dissect
That's good. That's fair. Um,
it.
I think I'll try to do both at the same time, because
Okay.
in learning the definition of human trafficking, that is how I got involved, right, in the anti-trafficking movement. Don't know, to be honest, that before trafficking, like getting involved in the anti-trafficking movement, I had a clear understanding, or
Mm,
even an idea that I thought I could say or articulate that was incorrect about trafficking. Just that I was like, oh, that sounds awful, and I'm not going to do it to someone. Like, that was the best that I thought I could do, which is probably like the minimum, right? Like, that everyone should be engaged in. Just don't do that. But what is that? And so I, like most people, am motivated by food, and went to a lunchtime talk in like the first few weeks, really, of medical school, and um, learned a bit, just very basically, that emergency medicine, which I knew I was going into, um, is what they call on the front lines of seeing people or interacting with folks who have a trafficking experience. And so I was like, at the end of the talk, I was like, well, what do I need to do to make sure that my specialty is better at this, and blah, blah, blah. Like, I was ready, raring to go. Because again, understanding for me that ethos that emergency medicine is for all comers, if that means that everyone's coming, but they're coming, but we're not taking care of them, that means that we're failing. It's on our side. How do we do better? Um, and I was tasked then, by the speaker, with educating my colleagues, who, they weren't my colleagues yet. I was a first year medical student. They would one day be my colleagues. Uh, they were my colleagues in spirit, right? So um, I understood, based on that tasking, that my first real task, then, before you can educate others, you have to educate yourself, right? So I spent 2 years going to conferences, listening to survivors, reading, talking to law enforcement agents, working with advocates, just trying to get whatever information I could get any way I could get it, all the while sharing that along the way with in spirit colleagues who were attendings and residents and PAs. And what I have learned over the course of these 15 years now, boils down to, very simply, the easiest way I think for folks to think about it is that one person or group of people, their work, in whatever capacity that work takes, whatever shape that forms, their work is exploited for the profit of another person. And the person who is being exploited may or may not be aware that there's even this thing called trafficking, but they are aware that they can't leave their situation because of force, fraud, or coercion. They may not use those words, but if you ask them, why wouldn't you leave that situation? Why didn't you leave? They wouldn't say necessarily something as simple as what I would say about why don't you leave your job, is like, well, how am I going to pay rent? Right? That's a very clear, like, well, you could get another job then. But something might be more like, well, this person is the parent of my children, and they hold all the money, and if I go, they said that they would tell the authorities XYZ, and I'd never see my kids again, right? That's coercive. Or if I decide to leave and say something, I'm on an H2 visa, I'll get deported, and going back to my gang-ridden country of wherever isn't safer. I won't be able to provide for my family, XYZ. So there's factors that aren't simply, I will be unemployed if I, leave this
Right.
job. So that's what trafficking is. It is labor and sex trafficking. As you pointed out, I think most folks focus on one of those. The majority of trafficking worldwide, according to our best understanding at this point, is labor trafficking,
Mm.
which makes sense, right? We're all participating in a labor economy, either as consumers, as buyers, as sellers, whatever. So it makes more sense that the majority of it takes that form of labor, and it can be in, I should point out, in legal and illicit industries. So
Mm.
just because something isn't a job that you could put on your CV and not have the police arrest you for, doesn't make it not a trafficking situation. So I've taken care of and served folks who were forced to shoplift and have those items be resold. The crime of shoplifting is a crime.
Right.
It's also how they were forced to stay in that situation, because they were told, well, if you say anything, you're the one who's going to get arrested. No one's going to believe you. And then I get the kids. So yeah, I think when we start to like see those little cracks in our understanding of what trafficking is, it's not, I don't want to like make it out to be this bigger than it is thing, but
Right.
you see the possibility for it in every industry.
And you're very intentional about using the word invisible, right? Population.
Yes.
And I think you touched on it a bit when we're defining what human trafficking is, that it can be right in front of your face. Like, it's not something that's behind the closed door. You got to go down the street and around the corner and through, 4 closed locked doors. This is
Right.
could be, the person who's sitting across from you at the dinner table or waiting on you at your, dinner or what have
Yes.
you. So my question, I guess my next question is, how do we encourage both clinicians and everyday people to what to your point, to see what might be
Mm.
happening in plain sight?
I think one of the simplest ways is some very basic reading. At this point, the internet has made so much information so available to all of us. I think the first thing you really do have to do is be willing, though, to hear that this is a thing, and that frankly you're involved in it, because I'm trying to not be, but I live in a labor economy, and the one that we have built at a global level is tough. I mean, I think folks will probably remember, well, folks of a certain age, we will remember, in the 90s when a certain athletic brand was outed as, having quote unquote sweatshops in other countries. And that was around the time of our beginning to, outsource a lot of, sort of lower wage jobs out of the US. That college campuses around the country were up in arms. Student activists were like, we do not want our university, our college apparel coming from this brand until they fix their ways, right? And that was, I think, thinking about conceptualizing it that way and realizing, oh, I see how I could be participating. And then, choosing to use the resources that are available to us. So when I was in medical school, I worked with a team of folks. We developed a website for emergency medicine clinicians. That content is relevant, I would say, to all clinicians, but in particular, I was talking to my people in the ED. But they can go onto this website. It's humantraffickinged.org. So human trafficking emergency department, but just ed.org. And learn about trafficking, yes, but also what do you do? How do you recognize the signs? What are the actions that you do or don't take clinically in that moment? What's the best evidence-based medicine that you can practice? What's the best practice, since we don't have a lot of evidence for some stuff? What do you do? That kind of thing. Another website that I recommend actually everyone check out is slaveryfootprint.org. I think it sort of wets your whistle, I would say, of, oh, I need to learn more. You realize how you, at an individual level, just living your daily life, doing your best, self-care, be nice to others, you're still participating from the moment you wake up and use your toothpaste. It helps you start to think about, well, where did my potatoes come from and who picked them? And even if it's not trafficking, was it exploitation? Were they paid a living wage? Were they safe working conditions? And then at the end, it's a little terrifying. It tells you like, well, you have 41 slaves working for you. And you're like, what? I
Ooh.
just, but how? You know?
Yeah.
And so every now and again, I do take it just to see. I mean, I'm always trying to work on my footprint, um, carbon and human. And, the number goes down a little. It doesn't change that much. But then they don't just like depress you. They also tell you how you can contribute to having less folks who are exploited participating in your life in ways that you don't even, know. Um, and so it does, offer you different vendors of purchasing products, et cetera. And I'll be honest, I think something that is troubling, and the reason that I really do focus on primary prevention and thinking about history
Right.
as our guide forward, right? You look back to move forward with purpose, is only people of a certain economic means can actually participate in an economy that supports a living wage, right? So it is this cycle that was purposely created so that the people of wealth have a choice. They can choose how they spend their money and where they spend their money. But after that, below a certain economic bracket, you have to buy what's available to you. And so you are potentially contributing to the oppression of another person who's in a similar boat, or maybe like a less great boat than yours. And you're
Right.
not wanting to, but are you really going to be able to afford 250 pair of dollar shoes? Like, it's to pay
Right.
someone else a living wage. It's really tough. It's really tough.
Well, one, so I will put both of those websites in the listen notes. So
Great.
for the listeners, you can definitely check those out. But speaking about a living wage, it also makes me
Mm,
think about the conversation that we've been having about essential workers, right? During COVID-19, and what does essential mean,
mm-hmm.
and how these essential workers are most high risk, patient population, if you will, during
Mm-hmm.
COVID-19. And the other thing that we were talking about, economics, because the economics of this particular population can be tenuous. Like you said, you might not know where your next check is coming from. I wonder
Exactly.
if you can speak to, and some of the concerns have been raised around violence in these situations, of coercion in these situations, because you're already talking about a population that's kind of living on the fringe, and in these uncertain times. Have you seen any difference in the human trafficking numbers over the past few months, or anything you're particularly worried about going forward?
Well, I would say it's tough for me to, in the ED, to say the
Right.
numbers are rising. As we mentioned before, it is invisible it is a crime, so it is purposely invisible. It's
True.
not like traffickers are coming forward saying, hey, I got two, I got
Right.
10, like, just so y'all can keep track. All right, cool, I'm gonna go back to it. That's not happening, right? It's
Very true. Very
so
true.
it's purposefully invisible, and then it's invisible in the sense that maybe as the patient that I'm seeing, or the client that someone else is seeing, or just the person, they don't even necessarily use or know that term. So they
Right.
just know life's hard, I'm doing the best I can, I'm in a bad situation, but it is what it is, I'm doing what I can, right? So they may not even use that term or identify in that way. Or they do know it's trafficking. They know, maybe they don't know it's trafficking, maybe they know it's a bad situation, and that they should, quote unquote, get out, but they can't for whatever those reasons are that are keeping them in,
Right.
that are coercive. Um, they're sort of stuck, so it's hard to count those numbers. So I'll caveat with that. Number one. Number two, I don't think that we're out of the woods yet. So it's, I think, a little too soon to count the hatched chickens.
Right.
I do see increased vulnerability.
Mm.
Logically, I think we all must, if we're giving it even just the littlest bit of thought, right? If you are suddenly unemployed and you were living paycheck to paycheck, and we have over 40 million people now on unemployment,
Right.
and that quote unquote safety net system wasn't built for this volume or this duration.
Right.
And then what about all the people who aren't eligible to apply for unemployment? And unemployment is not like a magical, like, fairy godmother wand where now you live in a castle, right?
Right.
So things are still tough. Um, the the vulnerability to be exploited has increased. Moratoriums on evictions are constantly being fought on both sides to, on the
Mm.
landlord side, to not have that, to end it, and to extend it for those who need to stay in. But it still doesn't answer the real question of what's going to happen when the moratorium ends, whenever it ends.
Right.
Is suddenly that all that back rent owed on day two? Is it owed a year later? Are
Yes.
you being paid twice as much as you were so that you can now pay last year's rent and this year's rent?
Right.
How does this all work out? And so then we have to ask ourselves, how do people survive? Because people survive, right? That is the nature of life. That is what people, your instinct, generally speaking, is survival, especially if you're not just taking care of you. You got to take care of other folks. They're relying on you. You end up in underground economies sometimes. You end up accepting offers that you would not have otherwise because you know you could do better. You might not be able to do better now. You might be afraid to access public benefits because then you become a public charge and then you can't stay, or you might get deported, right? It all spirals, and it's worse in a system where these things were all purposefully created and now they're being purposefully expanded and revised to be worse.
Mm.
So trafficking at a US level, I would imagine there is probably more of it. I cannot say that I know that for sure.
Right. Right. Well, I usually like to transition us to something more optimistic
Let's
as we
try.
come to
Let's
a
try.
close. But that was kind of heavy, so I'm trying to get us to a better place. But I mean, I think to your point earlier, I think, if as an individual we can educate ourselves, right? As clinicians, we can be a little bit more vigilant about trying to see things that aren't necessarily apparent. Um, I guess maybe as an advocate, maybe we can kind of transition and in there. You spoke some about what you can do in the advocacy role if you want to make change, and you speak into college students, which are very influential right now, right? The young people are out in the streets
Yeah.
right now in record numbers, and I think something different than we've been used to seeing in recent years. But I am optimistic that they will keep pushing forward to have some real change. So in the advocacy world, where do you think people can best put their efforts, or are there any policies in the pike that you think people need to support or start? We didn't. I mentioned in your bio that you started the Hill Trafficking Incorporation, but
Mhm.
is that an experience that more people need to get out and start things? Just, I mean, you can go any direction you want to kind of go. I gave
Okay.
you a lot. Sorry.
Well, I would say that, I mean, on the one hand, yes, if you think there's a hole somewhere and it needs to be filled and you have the skill set and the team around you to fill that hole, fill the hole. But I don't think that creating things is like organizations and NGOs and all of that is necessarily necessary.
Hmm.
Um, I actually think that when I think about primary prevention of trafficking, I think of Black Lives Matter and Native Lives Matter and Trans Lives Matter and Mother Earth Matters. These are the things I think of as primary prevention because these are the systems that there are systems that have been put in place to tell us, show us that Black lives don't matter, that Mother Earth doesn't matter, that trans lives are irrelevant, that all of these things don't matter, that all of these people don't matter. And trafficking is one symptom. It's an awful term and existence and thing, but it's actually the minority of experience of most of the folks that I just named in those groups, right?
Right.
Although we are disproportionately represented as trans, as Native, as Black, as any person of color group, any sort of disenfranchised, marginalized, purposefully marginalized groups, disproportionately either vulnerable to or represented among trafficking survivors.
Mhm.
Um, that being said, I think the work that people are not finally, there are people who've been doing this for centuries, right? But the folks who are jumping on the bandwagon, they're finally hopping on. That's the work that needs doing. So if you're doing, defund the police work, if you're doing transformative justice work, that is anti-trafficking work. If you're doing anti-poverty work, that is anti-trafficking work.
Mm.
If you're doing accessible housing work, because at the end of the day, why do people get trafficked? Because they had one option and another option, and they were both crappy,
Right.
right? So it's not about, oh, now that we see that this person is being trafficked, we can swoop in and quote unquote rescue or help them. Because if you don't, as a society, if we as a community, as people, don't eradicate the underlying problems that drove and pushed people to those situations, I mean, it's kind of like me giving you the hyperkalemia cocktail and not trying to figure out what's wrong with your kidneys.
Right.
You're just band-aiding a hemorrhage, and that cycle will continue. And it is an old problem. So as you did say at the beginning, this isn't, we've repackaged it and rebranded it and named it this new thing in 2000, when we got the Trafficking Victims Protection Act. I think the hope that I have now is we've been having this problem for centuries, not just the United States, but imperialism has certainly spread it to specific communities and places. We have this thing, and now we have a term for it, and now we're sort of in theory all on board, right? The UN is like, let's get rid of this. How do we do it? We do it with the work that is happening now at a louder volume, and we should continue to amplify the voices of those leaders who have lived experience, not just the academic ivory tower folks.
Indeed. And I think that was a great way to contextualize it in closing, in that because we're talking about health equity, right? And the key word is equity. And so when we bring everybody up together and hopefully operate on the same playing field, then we will hopefully eradicate these issues, like you said, that are a symptom of the bigger problem. So and that's what we're here to talk about. And hopefully we'll keep inching our way forward and making the world a little bit better for those who come behind us. So
yes.
But with that, thank you. I appreciate you taking the time to join us today and share your journey and your insight. You were quite inspiring, of course, and informative. And I hope our listeners learned a little bit and are motivated to some advocacy work out of this. So
thank you. Thanks for having me.
Thank you for listening to Read Scholars Live. Please follow us on Facebook, Twitter, or Instagram, or subscribe to our YouTube channel.